We're excited to try something new.
It's going to be fun.
We've got, essentially, we're trying to add lots of different content to give you something at least, hopefully, maybe mildly funny and informative on some level for your news feed. So hopefully you guys can join us. We're going to keep this going Thursdays.
We're doing this for the next couple years. Is that what you use?
Couple years, yeah. Maybe a couple years or
maybe a couple
few
Thursdays.
weeks. It's really whichever.
Okay.
Hey, Austin, don't you have some news for us?
Yeah, thanks for handing it over, Matt. Yeah, I got some cool announcements for you guys. Important. Pay attention. Put these on your calendars. Some things coming up. Small groups are not meeting right now. Not in person.
Not meeting.
Okay.
Throw that one out.
It's gone. Coming up, mark your calendars because we have a really cool Palm Sunday service. That's also not happening.
Well, it is happening. It is happening,
but not in
person.
So
we should throw out the notes.
You can tune in on it. Good Friday is also not happening. Who did all these?
I'm not sure.
And the hug dude.
Hug celebration.
Take it
Definitely
back.
Not happening.
That's it for announcements today.
So I was thinking, what is something that's interesting that we could read through that's pretty funny? I don't know if you guys have the Ring app, ring.com, but
it's a good one.
If you have a few minutes to kill and you haven't read this, these are real comments. These are not fake. I just want to throw you. First of all, as you begin to scroll, it appears like every animal in Lakeland is missing.
Or loose.
So
if
your animal is missing, you should check this app.
Mm-hmm.
But I just want to throw this one out. So this one here, you can see it says under the category suspicious.
Okay.
Very suspicious.
Dangerous. Watch your back.
What was the suspicious person doing? He was walking. He was walking on Woodsfield Way.
He was just walking?
And I think this is important in the comments. It did say he looked nosy. So if you're on Woodsfield Way and see someone who looks nosy.
Someone reported this? Is there a report?
Someone reported. And this is interesting. According to Neighbor 10, he might have checked the mailbox. We want to follow up on that for sure.
That doesn't seem like news, Matt.
That seems interesting. This is another one. We see an unknown person approaching the front door. What did they do?
Yeah.
Nothing.
But
they did approach the door. They approached the door and knocked.
This is reported news.
This is reported news.
This is what we're in for.
These are actual comments from our thing here. Now, this guy, anybody know this punk? Very bold under the suspicious category. Anybody know this punk?
That's what the title says?
This guy walked past their house. The nerve of this guy.
Right, past the house.
What the nerve of this guy? I don't know who this punk is, but I'm already upset.
LPD.
The nerve of him to walk past their house is unbelievable. At a time like this.
Yeah.
At a time
what
like
time
this,
was it? Like 5:45 p.m.
It was.
Oh
That's
my
weird.
Gosh. This is
another
outrageous.
one. Nice try, guy. Nice try. He was definitely going to steal this young lady's packages, but they were able to deter them.
You don't say.
So a lot of things here.
That's spicy stuff. We should probably save that. I don't know that.
There's definitely a lot of good stuff. Neighbor 18 says he has an ID on his chest.
Neighbor 18.
So I don't know if there's anyone to circle back on that. But listen, if you get a minute, Ring.com is pretty hilarious.
Check in on Neighbor 18.
We do have a special guest with us today. We're going to pass it over to Brandon Paget, our other co-host. He's going to be interviewing Dr. Jarrett Gregory with Watson Clinic. He's on the task force for our local COVID-19 response. So we want to hand it over to them and hear from these guys.
Awesome.
Hey everybody, Brandon Paget here, and I am with none other than Dr. Jarrett Gregory. Dr. Gregory, thank you so much for having this conversation with us now. I know it's going to be so profitable for the people out there. There's so much information, but we really felt like it was necessary to talk to a local expert. So what does make you uniquely qualified to talk about COVID-19?
Thanks for having me today. I am a double-boarded internal medicine and pediatric physician. I practice urgent care medicine here at Watson Clinic in our new Urgent Care South location behind Target in the Oak Bridge area. I'm also a member of the Watson Clinic Coronavirus Task Force. Watson Clinic's been around since 1941. We've navigated some of these pandemics throughout the years, and our administration actually started preparing in mid-January in collecting supplies, the PPE that you've heard, which stands for Personal Protective Equipment, getting access to test kits and making arrangements for us to be able to provide that screening in the community.
Well, could you help us kind of understand what's the state of the union? Both maybe on a global front and then maybe like United States, but then really make it local oriented here so we understand what's happening in Lakeland and Polk County.
Exactly. Every morning at 8:30, Watson Clinic's COVID task force gets together. I can tell you these numbers that I'm about to give you were collected through the 8:30 a.m. Huddle meeting this morning. Globally, we're looking at just over 950,000 cases of coronavirus and a little over 48,000 deaths as of this morning around 8 o'clock. Looking at the United States, there are approximately 216,000 cases of coronavirus, just over 5,000 deaths to date. If you narrow that scope down into the state of Florida, we are just over 8,000 cases as of today. Almost 1,000 of those cases are hospitalized and more than 100 deaths. I think we're looking at, as of around 11 o'clock today, I did a quick update, about 128 deaths in the state of Florida. But when we look at Polk County itself, we have approximately 90 cases. 37 of those are hospitalized and 2 of those have resulted in unfortunate death. Specifically here in the city of Lakeland, we have 21 known cases of coronavirus. Davenport has 26, Winter Haven has 19 cases. And when you break out those cases, you can see the age ranges anywhere from the age of 3 to 88 years of life. Predominantly females for our area of the country. 39 are men, 52 are women.
Okay, wow. So that's really helpful as you have like lots of news articles that are floating around, just to get like the real raw data from somebody that's just really honed into what's happening. Can you help us understand, like, what is the next month going to look like? I mean, can we even scope out to the next year? Because think about it, our lives over the last 3 weeks have completely changed, right? I mean, we were hanging out, we were doing church with Redemption Church, and we were going to places, we had travel plans. All that was shut down, and now we have a state mandate starting at midnight tonight. Stay at home, don't leave home. What does the next month look like? Can we forecast to the next year?
It's a great question. None of us have a crystal ball. We can definitely say over the next 30 days with the mandate from the governor, stay at home unless it is absolutely essential that you come out. Yeah. How does that relay into the next 6 months, the next 10, 12 months? It's difficult to say at this time. We are still honing in the ability to specify the phenotype. That means the symptoms that patients present with. And the symptoms that I'm looking for in patients today are different than I was looking for last week. Yeah. The things that I'm aware of. We have not peaked in the number of cases that we'll have in Lakeland. We are certainly...
help people understand that. So when are we looking to potentially peak?
So that is likely to be the early part of May.
Okay.
When you look at the long-range epidemiologic studies that have been performed in Italy, China, several places throughout the country, you have a basic timeline, and you apply that to the number of individuals in the country.
Okay.
You apply that to the number of individuals within the state or within your community, you can come up with a strong prediction. We are predicted to peak in the number of coronavirus cases around May 1st or the May 3rd benchmark.
I think that's really important for us to understand, because people are going to be like, hey, wait, we've been cooped up for like 6 weeks, and this thing keeps escalating. So why is it escalating? May 3rd is like peaking potentially for us as we look at the data. But we're like staying at home. So how do we reconcile those two things?
One, we have better ways of testing. More test kits have been made available, so the number of reported cases are going to climb because we're testing more people.
Gotcha.
We've also got a group of individuals from various states coming into the Florida area thinking it's spring break, sort of ignoring some of the previous suggestions to socially distance yourself. That brought a good number of cases into our community itself. And so you can break out some of those Florida and non-Florida resident cases. Specifically the hot areas around the country, New York, New Jersey, New Orleans, Connecticut, those individuals coming in. It's difficult for us to know exactly how they have affected, but we do have some literature to say they definitely brought some numbers into our area, specifically into Central Florida.
Got it. So the number of testing kits available, the testing amount, I mean, we're finally kind of getting a handle on what this thing actually is, which is why we're kind of seeing some of the skyrocket, if you will.
You'll see those numbers continue to climb because you collect the test. It's a nasal swab similar to the flu, and then it takes anywhere from 5 to 7 days. It's a polymerase chain reaction. It's a sophisticated molecular test to help us identify the individuals who have the virus and those who don't. You'll see that number continue to climb and peak around the early part of May, mainly because though we have now created a stay-at-home mandate The number of weeks that there have been transmissions from person to person will continue to manifest. We'll continue to diagnose. We'll continue to report that information.
Yes.
And unfortunately, not everyone's going to strictly adhere to the stay at home. There will be some individuals who choose not to follow that, which will contribute to that peak around the early portion of May.
Well, one of the big questions I know people have, and I had initially, because initially I was like, hey, this is like the flu, you know? And so can you help us understand how is the COVID-19 different from the flu and maybe even some past pandemics that people have lived through?
It's a good question. We get this a lot at the urgent care. So if you look at COVID-19, and just for nomenclature's sake, it's actually SARS-CoV-2. That's the appropriate name for it. It is an airborne transmission. There are varying degrees of what surfaces it can live on. We know that it's destroyed by heat. We know that it can be destroyed by bleach. Lysol does not work very well.
Okay.
Bleach
Note
cleaning is the appropriate process to actually sanitize and get rid of the virus. But then you look at the flu. So coronavirus has a very specific transmission through respiratory droplet. So does the flu, but there are different strains of influenza or the flu that manifest as a cough, a fever greater than typically 100 degrees Fahrenheit, congestion, they feel kind of fatigued, and body aches. The number of varied presentations in a coronavirus patient is pretty vast. And you can have anyone come in from, I have a sore throat, I have a dry cough, to I'm having trouble breathing, I'm getting short of breath, moving from my kitchen to my dining room. That varied presentation makes it challenging as a clinician to hone in on those individuals. And that's where you have to take a really good history and talk about, have you had chronic lung disease? Do you have diabetes? Do you have hypertension? All of those variables can play a role into the outcome and the diagnosis. It's not also just from a standpoint of how to treat Tamiflu or oseltamivir. I can prescribe that to a patient with flu.
Yeah.
They're going to feel improvement, particularly if you get it initiated within the first 24 or within 48 hours of onset of symptoms. We don't have that antiviral medication in place.
Yeah.
Yes, there are drug trials underway. We've heard about hydroxychloroquine and azithromycin, particularly being successful in the hospitalized patients.
Yes.
But as far as an outpatient setting, we know we need to stay away from steroids. That's actually exacerbating or getting the disease to progress a little bit quicker, which we don't want. We want to slow it down, reduce the transmission. Then we look at the vaccination capability. Coronavirus, there is a very good trial out of Seattle right now that's going through the appropriate trials for creating a vaccine for coronavirus. There are several trials and phases that one must go through in order to get a drug from the bench or in the laboratory up to the market where it can be administered safely to patients. Now we have a flu vaccine. The CDC records what was last year's outbreak like, designs a new vaccine. We come in, we administer it before the onset, typically October. We want to get patients with their vaccine shots up to date. We don't have that capability just yet. But then we also want to compare coronavirus and flu when it comes to the number of infections. Well, in the world, coronavirus is looking at about 950,000.
Right.
Influenza can range anywhere from 900,000, a million, a billion individuals.
Wow.
So that when you look at a magnitude standpoint, influenza can spread much more quickly, but its virulence or its degree of severity of when it infects much higher than that of influenza itself. Coronavirus is very dangerous when it infects the patient.
Got it. So, okay, right now we're getting like up-to-date information, like you're giving us the latest. But when we get out a week from this thing and we're scrolling through our social media, I've got so many friends that post every and any article they can. How can you help us decipher what is appropriate, what is real? As we're reading through our social media feed and the next news article, how do we decipher what is like actually going on and what is a little bit more like clickbait or
So you've got to be
fear-mongering?
careful. You want to be, to avoid the buzz phrase, fake news, but there really is some poor literature out there. And certainly we're all concerned and appropriately cautious about our social engagement.
Yes.
But if you are going to get solid information, you need to go to cdc.gov
Okay, you hear that? cdc.gov.
or who.int. That stands for World Health Organization.international.
All right.
And
yes.
then one particular site that I have been finding useful with evidence-based reporting is covid19.healthdata.org, covid19.healthdata.org.
Yes.
It is a very up-to-date, you can select what country, what state, what county you want to report from, and it's updated periodically throughout the day to give you the most recent in terms of numbers, the deaths, the numbers of cases reported, and where we stand with, probably you've heard Abbott Pharmaceuticals coming up with the 5-minute rapid coronavirus testing, where that is. And that's federally driven at this point.
Okay.
So that only the hot spots, meaning there's a certain number of cases in a particular portion of the country, the federal government's going to drive that to be delivered specifically to those spots to try and control and contain some of the outbreak.
That's really good. So use those websites that Dr. Gregory just gave us as kind of your baseline. And so you filter all the other news articles and videos kind of through those websites so you can better understand this. You know, a lot of people right now, and I got to admit, a few days ago when I kind of caught wind that it looks like we're going to be going into a lockdown, I was down a little bit because I'm an extrovert, right. I'm a hugger, and I'm like, oh my goodness, we're not going to be able to hug people, we're not going to be able to hang out with people. Could you give us some hope right now? What kind of hope do we have in the midst of something that's very uncertain? You're even saying, hey, symptoms, we're not even exactly sure. They're manifesting themselves in different ways. How, with such uncertain times, can we have hope?
First, we take refuge in our Savior, who is omnipotent and He is sovereign.
Yes.
I think you should look at your local environment. It's not just a plug, it's a reality. Watson Clinic was started in 1941 by a group of 3 or 4 physicians, and now there's close to 220, 230 physicians dedicated to providing care in this community. We have the infrastructure, the administrative leadership, the number of providers. We have 2 urgent cares now with adequate testing. We have access. So there's hope. There's positivity in, if you need access to a physician, you've got multiple urgent cares, Urgent Care South. We have telemedicine that Watson Clinic is really ramping up. I was just doing a televisit video this morning with some encounters to get patients information who aren't comfortable coming out. And then, the vaccine trials, I think that's an excellent opportunity for us to look at and say, there's some good opportunity here for us to advance medicine, but also to eradicate a very dangerous and virulent virus.
Yeah, that's really good. And so we do want to encourage you. Stay hopeful. Like, God has not left us. Our Savior has not left the throne. He's still on the throne. And then we have some medical advancements with the just access to medical care. Hey, if you're feeling sick, seek out medical attention quickly. And then we're very hopeful in what is happening, because I'm seeing around the world the kind of run to find a vaccination is happening by so many brilliant people that it gives us a lot of hope. And I could say this, when you go back and look at other pandemics, people got through them. Right. I mean, and the church survived. I mean, how cool is that? Like the Spanish flu, 3 years from 1918 to 1920.
Exactly.
And guess what? We pushed through. We made it. And so have great hope. We are far more medically advanced.
True.
And of course, we have the unchanging truth of the gospel of Jesus. Dr. Gregory, thank you so much for joining us and giving us that helpful information. Again, if you need any medical advice, of course, urgent care, Watson Clinic South, he heads that up. He would be more than happy, and they would be more than happy to help you. Now, I'm going to sit it back over to the knucklehead, Matt and Austin. See you guys soon.
Guys, welcome back.
Thank you, Dr. Gregory, for that. That was great information. A lot of stuff that I really didn't realize.
Some good websites to look.
Great websites. And I think
information
those are
correct.
Those are in the comments.
Yeah.
So you can definitely follow up with those. Those will be there for you guys.
Really good stuff.
I do think, I love the first point, take refuge and hope in our Savior.
Yeah.
To that effect, I think it's great for us to read this verse. It's out of Psalms 59. It's from when David was being pursued by Saul, but he says this in verse 16, "But I will sing of your strength, will joyfully proclaim your faithful love in the morning, for you have been a stronghold for me, a refuge in my day of trouble. To you, my strength, I sing praises, because God is my stronghold, my faithful God." And I think, Austin, that's what we have to remember is that we not only can take refuge in our Savior and comfort in that, but also that we have this incredible online community
That's right.
of people who are committed to keeping us engaged. I know as extroverts that can be very hard.
It's very
for
difficult.
us. We definitely want to have our hug celebrations. We want to definitely have those, but I think having this engagement in this way has been very, very helpful for us.
Yeah, just to follow up on that too, I think the importance of what you said and Dr. Gregory said is just that refuge being outside of ourselves. Given all the circumstances and the unknown, the fact that we can run to God and Him still be our refuge is so important in this time, for sure.
Hey, why don't you tell everyone how they can keep updated with what Redemption is doing, Redemption TV?
Sure. Yeah, so first thing is to like, follow, subscribe. We post this on Facebook, and I might be YouTube later.
It'll be on YouTube.
On YouTube,
yes.
so you can certainly follow us there. Every time we go live, you'll be notified as well. I'd encourage you to check out the website. It's tv.redemptionlakeland.com. That's going to have all of our schedule for upcoming live events, so that's a good way to follow us.
Great resource.
And then, if you want to join Redemption Church online this Sunday at 9:30 and 11 a.m., we're going to have 2 unique services. It's a really great way to stay plugged in with what Redemption Church is doing here in the future.
Absolutely.
Yeah.
Well, again, thank you to our guest. Thank you guys for joining us online.
Thank you so much.
Big thanks to all those who made this possible today, Redemption TV. Thanks for joining us. We will see you next Thursday at the same time.
See you next Thursday.
Other points. Thank you guys.
See ya.